everyone, and welcome to the Doctor Janine Show. I am so happy to have you all here today. I'm so excited about today's topics, and we're talking about something that you may or may not know all about, this very important topic, especially for women's health. So I'm going to break that down for you. It's called BII. If you know what that is, please put it in the comments if you know what BII is, okay? I'm not going to let you know just yet what that is, but we're going to talk all about that really important topic. Now, we're also talking about vitamin do's and don'ts. A lot of people are making so many mistakes, you may be as well, in terms of the type of vitamin that you're taking, but more importantly, if you are taking vitamins, and even good ones, maybe you're taking them at the wrong time in the wrong combinations. I'm going to break that down for you, all about vitamin do's and don'ts. Today, we're also talking about a very common deficiency that a lot of people don't realize that they have. It is a zinc deficiency. So I'm going to go through some of the signs and symptoms of that zinc deficiency and talk about that today as well. And it's something that was very common over the last few years with people getting sick with certain infections and things. So that is something that's really important that we discuss, zinc deficiency and why that's so important for your immune system. Okay, we're also talking about, by popular demand, I had a bunch of you that were asking about what to do for hollowness underneath the eyes. I've got a great technique for that. So that is coming up in the beauty set as well. And we're talking about cholesterol. So the great cholesterol myths. There's so much misinformation about cholesterol out there. We're going to talk about that LDL cholesterol and some things that you would have never expected with high cholesterol levels, okay? It's actually good news. And of course that BII. Now, if you did miss last week's show, we talked about fake apples, yes, and all of, unfortunately, and toxins that go on the processing of what's supposed to be a healthy fruit. So we talked about that and some ways to mitigate that. We also talked about anti-aging tips. We talked about the back and scoliosis. So if you missed it, I gave you my tips last week, all for scoliosis and what you can do even for if you've got chronic back pain. We talked about that as well. And I made my famous bug spray. So that all natural bug spray. Love it, love it, love it. I hope some of you mixed it up. Please say hello and where you're from. Maureen in California, nice to see you. Thank you for tuning in. Grand 2003 in California. Great to have you all here today. Now this is really important that we're tuning in, and of course, okay, body mass index, Ben Janivs, nice try. BII, does anybody know what BII is? I'm gonna start the show with talking about BII. Does anybody know what it is? Okay, we're going to talk about that in just a second. Hello in Cyprus. Paco, nice to have you here. Thank you for tuning in. Hey, hit that subscribe button. Make sure you hit that follow button. If you're new and here for the first time, let me know. Put a 1 in the comments as well. Central Valley, Cali, Sean's Classic Trucks. Thanks for tuning in today. I am Dr. Janine, naturopathic doctor. We talk things all natural here on the Dr. Janine Show, and we have different topics every week. We do this every Tuesday at 11 a.m. Eastern Standard Time. Okay, a hint. Somebody, a queen for days, wants a hint. It has to do, yes, Auntie Wen. Look at her answer. Breast implant illness. That's what we're talking about. Now, this is a really common thing. Some women have no idea about the implications of having breast implants. I'm going to talk all about it because I've spoken to numerous women who have gone through and have been very sick because of the breast implants, okay? So guys, don't change the channel if this is something that you think is not for you. Yes, it is, because quite likely either you know someone or you will come in contact with a woman who has breast implants, and I'm all about sharing information about health and dispelling a lot of the myths out there. And a lot of people just don't know how those breast implants can be impacting their overall health. It has more to do with the autoimmunity aspect of this, and this is really important. Okay, so that good for you who have an polexicin too. You knew exactly what it was. So it's something that isn't discussed enough. That's why I wanted to make sure that we talked about it in today's show. Now we will be coming back to the beauty set, and we will be talking about my guasha technique for around the eyes, for those hollows in the eyes, and that is going to be coming up. Okay, so let's talk about BII, breast implant illness, okay? And it is a very common thing, and this is something that is related now to your immune system, and there's an inflammatory response that happens as your body is reacting to, and it doesn't matter what type of breast implant it is. Because it was once discussed that, okay, if it's silicone, yes, that's one thing. If it's saline, yes, that's another thing. No, they're all the same. Your body can react because it's a foreign body that is in the woman's body, okay? And this is where the immune system can react and lead to autoimmunity. And there could be symptoms associated. I'm going to go through the list of symptoms that are commonly experienced by women who do have these breast implants, okay? So they can be the saline type or they can be the silicone type of implants, all right? So yes, let's go through the list, I believe, that I have now of all of those symptoms that can start soon after the implants are actually put in. And it's something that you can also, because it's actually recommended that you don't have implants for longer than 10 years. So it's not something that you keep forever. You need to have them redone, and not all, women are aware of this. So that's one thing if you choose to keep them. But here's the thing, after they've been replaced, and I've spoken to women after they've had their replacement done, that their symptoms then appeared after getting the new ones in and the replacement. So here's the thing. So a lot of women start with having their symptoms soon after having their implants put in, okay? So fatigue is a big one. So feeling tired all the time, you're not sure why, you never maybe would have expected. That could be related to your breast implants, as well as, of course, weight gain. Oh yeah. So did you know that you could be gaining that weight? And again, there's an inflammatory process happening. The body is very smart. It knows what should be in there and what shouldn't be there. So an inflammatory process could be happening with that weight gain, and a toxicity component as well, and that's why the weight could be coming on, as well as joint pain. So I'm gonna have my friend grab my joint really quickly over here. So that joint pain is really important, because this is something that I've, spoken to many women who actually have severe joint pain, even, rheumatoid arthritis, which is another, and this is something when you've got a lot of inflammation, an autoimmune component of having the breast implant. So that is really common as well. Okay, as well as constipation. So I have a funny story about the poop platter. Let me share this really quickly. So if you're tuning in for the first time, I'm Dr. Janine, and yes, I became famous on one platform, all because of the poop platter. So last week we're recording in the studio, and I have to do something talking about constipation, whatever. I was recording a video, one of my short form videos, and I'm like looking everywhere in the studio here for the poop platter, couldn't find it. Where is the poop platter? So the poop platter was MIA, and luckily it was found, it was left on the television set that I frequent at least once a month here in Canada, and so it was left at the television set. So yeah, there were some funny jokes behind the scenes looking for the poop platter. It is back. I'm very happy to have it here, but constipation is one of those very common symptoms of having those breast implants and that breast implant illness. So that is very common as well. Let's continue with our list over here. Thyroid disorders. So how common is this? Again, it could be an autoimmune component because the body's reacting to the breast implants. And this could go, I'm talking breast implants, but it could go for other implants, because I know that people have other types of implants as well, which could be similar, in structure to those breast implants, just saying. So thyroid disorders as well, either low or hyperthyroid, as it's related to the illness. Okay, number 6 on the list is brain fog. So this goes along with the fatigue as well, but it could be a lot of brain fog. You just have a hard time concentrating as it's related to the breast implants. Number 7, of course, is muscle weakness. So you just feel tired. There is that inflammatory component as well with this, as well as number 8, rashes. So your skin starts to break out as well, and that is common in autoimmune disorders and hives and things because your body's actually reacting to those implants. And of course, number 9, dry eyes. So the eyes, and a lot of people do have this symptom anyway, but dry eyes, again, very much related. So Sjogren's disease, if you've heard about that, and constant dryness of the eyes, that is autoimmune, related back potentially to those implants as well. And of course, you're not going to like this one, a lot of women actually experience hair loss. And number 11, a lot of anxiety and low mood depression because of having the implant. So yeah, if you know, I want you to screenshot this list if you have the ability to do that. If you know somebody or if you yourself has breast implants or other types of implants, please take a look at this list and start to make connections for yourself that potentially that can be correlated to having the implants, okay? So my tip here, consider having the explant surgery, And that is something that is, definitely going to be a big decision for you. But at the same time, after maybe having them removed, I always, caution women that, yeah, it's one thing to take the implants out. It's another thing to actually detoxify and start to clean up the leaky gut and to deal and do a full body detox, get those toxins out so that you can feel so much better. Because some women, when they are removed, they feel a lot better. Other women, they're not necessarily feeling better even though they've had the explant surgery. So doing that full body detox is a really important thing to do, as well as fixing, of course, that leaky gut, as I said, but also fixing your leptin signaling. So that leptin resistance, a lot of these inflammatory markers and that inflammation in the body goes back to something called leptin resistance. As you know, I'm the queen of leptin resistance here on social media. I talk a lot about it. If you don't know what it is, please check out my other content. Really, really important, especially if you're trying to lose weight and you are, struggling with balancing your hormones as well. Christopher, nice to see you. Hello, thank you for tuning in. It's great to have you here. Thank you to everybody who's here for the first time, and hey, hit that share button. Thank you for sharing with your friends. Hey, I know that Chris Lee just followed. Thank you so much for the follow. Great to have you here. I know that you may be here for the first time. You haven't followed before. And Double Hearts is here, as well as Ali and Addie Boutique. Thank you for following. Great to have you all here today. It's amazing to have you here. Okay, so why is it... Oh yeah, so Tina is saying, why does insurance not recognize this? You had to pay for the removal. I know it's very expensive to have the explant surgery, as it is to have the implant surgery. I know. So I don't know. I don't have the answer for that. I wish I did, but it's definitely money well spent to feel better and to have it removed, especially if you do have the symptoms of BII, okay? So I do want to say, a great shout out to my viewer spotlight of the week, and this is Lori R. And Lori said, I trust your advice. Thanks for educating us. Thank you so much, Lori. So great to have such great positive feedback, and we choose a different viewer spotlight every week, which is amazing. Thank you so much. Now, I am going to talk now about vitamin do's and don'ts, but coming up, I will be talking about cholesterol and some myths around cholesterol, and actually some good news with cholesterol. So usually it's always, not the best news when we're talking about cholesterol, right? You go to your doctor says, oh, your cholesterol's looking a little high. Well, today it's all good news, okay? Because there could be some things that you're doing that are healthy that's raising your cholesterol, so it's not necessarily a bad thing. Okay, let's talk about those vitamin do's and don'ts. So when we're talking about vitamins, this is something that a lot of people are making a lot of mistakes in the way that they're taking their vitamins. Number one, if you're taking the wrong type of vitamins, you know that I don't like these synthetic ones that has a huge, gigantic list of all the chemicals on the back. No, that's a synthetic vitamin. You want to focus on whole food vitamins that are definitely healthier for you. But even if you're taking good, high quality vitamins, you could be doing it wrong, and you could be taking them in the wrong combinations at the wrong time. So let me break it down for you. I'm going to make it really simple for you. What to do in the morning and what to do later in the day. Okay, so here are my favorite morning vitamins, okay? You gotta commit this to memory, and usually it's something that you've never heard before, especially when we talk about the first one, which is magnesium. Now, I know you've always been told take magnesium close to bedtime, it helps with sleep. Well, I do things differently. I like magnesium in the morning. When you're taking the right type of magnesium, that magnesium helps with your metabolism. That's important if you're trying to maintain a healthy body weight, if you need your energy throughout the day. That magnesium is really important to counteract from your EMFs in your environment as well. I hope everybody has seen my podcast with the EMF guy, all about EMFs and how they impact our health. So that's something that I definitely want you to check out if you've not yet seen it. But you want to take magnesium in the morning. This is how you remember it, okay? Magnesium in the morning. Okay, it's going to help with your metabolism, helps with the regular beating of your heart as well. That's important throughout the day, helps with your stress levels. So magnesium in the morning, okay? Now, the next one, of course, fish oils. I like fish oil in the morning, and why is that? Well, it's very anti-inflammatory, and I like the fact that to have that anti-inflammatory effect. I also like to take it with my eye supplement. So the lutein and the zeaxanthin, those really important carotenoids in an eye supplement, I always take together with my fish oil sometime in the morning, sometime before noon, because that healthy omega-3 in the fish oil helps with the absorption of your lutein and your zeaxanthin in your eye supplement, okay? As well as I like anything that's gonna give you energy, so vitamin D3 in the morning. I also like my B12 in the morning. I don't know if we have that one on the list as well, vitamin B12, yes. Anything that's gonna give you energy. Coenzyme Q10 is another great one in the morning. I like these in the morning because they give you that energy and that stamina, and it helps you to get through that stress of the day. Okay, so those are the morning vitamins. Now let's take a look at the night. Everybody got this list? I hope you screened it. We can come back. So if you're missing something, if I'm moving too quick, we'll come back. Just call it up in the comments, okay? Nighttime vitamins, the ones that I like and prefer at nighttime, so you see the nice moon here, of course, is vitamin K2, and there's a reason for this. Vitamin K2, along with our calcium, that combination together closer to bedtime. Calcium goes into your bones best when you're sleeping, when you secrete naturally more of your growth hormone. So that's a great way if you're trying to, maintain your muscle, your bone mass, of course, your healthy teeth, is to do this combination closer to bedtime. All right, and calcium can bind other minerals, so we don't usually take calcium with too many other things. I like it, as I keep it right beside my bed, and I always bring my water up to bed with me, and it's right there, and I take it just before bed. But I've been able to help so many people with this, changing and my patients in the past as well, just changing up your routine. It can really optimize your proper absorption of your nutrients so that you're feeling better. You wake up with more energy, you have better sleep. So this combination, amazing for a good night's sleep and really helping you to get into that deep, deep REM sleep and you remember your dreams, which is amazing, okay? As well as sleep and relaxation, herbal medicine, supplements. You're taking these, of course, closer to bedtime to help to induce that nice relaxed state in your parasympathetic nervous system, okay? Does that make sense? I hope that makes sense. Yes. Okay, so remember those, commit that to memory. You don't want to take your calcium and magnesium together. That is the wrong way to do things. They actually compete for absorption, and you won't optimize your absorption of your minerals if you take them together. All right, so we're going to talk about now zinc deficiency. Now don't forget, we do have quiz questions coming up. So if you're here for the first time, welcome on in. I'm Dr. Janine. This is the Dr. Janine Show. We do this once a week, live on Tuesdays here in the studios, and every week we play for a different prize. I will be announcing last week's winner. So stay tuned for that. From our great sponsors at Vitatree Nutritionals, okay, they sponsor the show. That's how I'm here. We will have quiz questions, so I hope you're paying attention. That's my little hint, okay? Because you're going to answer those questions in the comments, and you could win a prize, all right? So is everybody ready? Okay, we're going to talk about zinc deficiency now. We'll also be going into the beauty set, and I'm going to talk about guasha. So for all of you who love to do your guasha, that massage and lymphatic drainage around the eyes, we're going to talk about the hollows underneath the eyes and really brightening the eyes with the guasha. That is coming up. Okay, let's go through the common signs and symptoms of being low in zinc. So how do you know if you're low? It's not something that usually your doctor is testing for when you go into the doctor, but here's some common signs and symptoms. We'll just kind of go through the list. Loss of taste and smell is a big one in terms of zinc deficiency, and I think we've heard about that a little bit in the last 3 years or so. Yes, the zinc deficiency, loss of taste and smell, lack of energy, white spots on the nails. So if you're getting those white little spots on the nails, that can be related as well to that zinc deficiency. A lot of lack of energy, exhaustion, as well as dry eyes, blurred vision, smell disorders, taste disturbance, as we talked about, and inflammation in general. Dry skin, acne is a big one in terms of that zinc deficiency and helps in terms of strengthening. So if you've got a lot of rashes and things, zinc actually helps with your proper structure of your collagen. So that's really important in terms of chronic skin issues. And I had a patient who had chronic boils, and for whatever reason, she had chronic boils. So that was one of the things that I determined, along with her other symptoms, that she more then likely had a zinc deficiency. So started supplementing with the right zinc, because there's a lot of wrong zincs out there, but with the right zinc. And my favorite type, can I tell them? Yes, I'll tell you. Of course, is zinc bisglycinate. I'll come back to it in a second. But supplementing with that zinc bisglycinate without any fillers really did clear up. And she had boils for years, I think 7 or 8 years, and they completely cleared up and didn't come back just because of that zinc deficiency. So something to think about with chronic skin issues or infections as well. We know that it helps our immune system, thinning hair and hair loss as well, and of course weak immune system. Even in terms of high blood glucose levels, that can be related to a zinc deficiency. So take a look at that. If you're prone to wrinkles in the skin as well and you're wanting to slow that down, much like vitamin C, zinc is really integral in maintaining that proper structure of your collagen, and that's one of the reasons why zinc can be really helpful for slowing down that aging look or process in your skin, which is amazing. Okay, everybody got that? Time to move on. Guess what time it is, everyone? It is quiz time. Okay, so we are at quiz question number 1. This week we're playing for the Vitatree cholesterol formula. Okay, is everybody ready for this? I hope you're paying attention. This is from our great sponsors at Vitatree. We thank them, Whole Food Vitamins, for supporting the show, supporting me, so that I can come and speak to you every single week live. And amazing, amazing, amazing. Okay, are we ready? Here we go. You've got 30 seconds on the clock if you're here for the first time. Just put your answer in the comment section and then we'll come back. I will reveal the answer after that 30 seconds. Here we go. When is the best time to take vitamin K2? Put it in the comments. Get your answers in now. Okay, we've got about 12 seconds left. I hope everybody's getting your answers in. Let me take a peek. Good job, good job. Mary, Carla, Raj, Dr. Ranjit, hello. Thank you for tuning in. Thank you to everybody who is giving your answers. All right, we got them all in. Everybody, I'm giving you a few more seconds. All right, all right. Good job. Most of you got it right. Okay, the best time, of course, to take your K2 is closer to evening, nighttime. Again, with your calcium, if you take a calcium, remember your calcium is a whole food calcium. Don't take regular calcium. We can talk more about that in future shows, okay? What type of calcium to take? I think that's a big topic that a lot of people would probably want to learn more about, okay? You got to be a little bit careful with calcium supplementation. Okay. Now, I do want to announce last week's winner of the Vitatree Hair, Skin, and Nails was Kathy. Did I say that correctly? Congratulations, Kathy. Awesome, awesome, awesome. Good job. You are the winner of our hair, skin, and nails from our last week's show. Amazing job. Everybody else, you've got a few more opportunities to answer the questions about the quiz questions. So remember, you're paying attention to some of the content that I'm sharing so that you will do well in answering the questions, okay? So let's talk now a little bit about cholesterol. Now remember, cholesterol is not the bad guy. Cholesterol, we need cholesterol to make our vitamin D, to make our hormones. And there are some causes of high cholesterol, which I'm going to talk about, some of which you may have never heard about, and maybe, you know, this is related to you and this, or to someone that you know. But cholesterol, when we're talking about this paradox that actually exists, and what has been discovered more recently is that elite athletes can actually have very high cholesterol, okay? And this is based on some research. So if we take a look at this really quickly, and when we talk about cholesterol, everything has to be put into context as to why the cholesterol may be high in the first place, and not just, you know, read a high cholesterol on a blood work, you know, results and say, okay, we need to lower your cholesterol. There's a context that goes around having high cholesterol. So here, really quickly, the explanation for the paradox of the high circulating cholesterol in highly trained endurance athletes who adopt a low-carb diet. So here's the thing, the keto diet can cause your cholesterol to go up, and because of that higher intake of saturated fats and cholesterol and an increased demand for lipid metabolism and corresponding expansion of the intravascular cholesterol pool to accommodate the dramatically accelerated rates of fatty acid oxidation. What that means in English is that athletes who, especially if they're going a little bit lower carbohydrates, higher fat intake, they need that extra fat to actually sustain their energy levels through that intense exercise. And I'm not talking just, this is why I'm sharing this, because a lot of people are not elite athletes, but you're doing low carb and you're working out, maybe your cholesterol is high, and that's not necessarily a bad thing. That's my whole point, because now your body needs to use those excess fats that you maybe, and healthy fats, like I'm talking avocado, olive oil, some of the things that we talk about here on the show, being healthy fats, which are good things for your body, great to feed your brain. But now your cholesterol appears to be high on your blood work because your body is now utilizing more of that cholesterol in your fatty acid oxidation, and you actually could be burning more fat. So you're getting healthier, your cholesterol goes up, and you're like, what is going on? I spoke to a woman at the gym the other day, and I hadn't seen her in a long time, and she's working out at the same gym now, all excited. And yeah, she said, oh, I went to have my blood work done, and sure enough, my LDL, which is supposed to be the bad cholesterol, the low density lipoprotein, was a little bit high. And I said, don't worry, it happens, because now she's working out more. I said, it's possible, and I don't know everybody's story, so don't start sending me your cholesterol numbers, because I don't know, but this is something that's possible as you're getting healthier, that your cholesterol is actually improving, which is a good thing. Okay, so this is amazing. This is something that now, when we continue on and talking about cholesterol, it's a great thing to know that, yeah, maybe your high cholesterol isn't always the, doom and gloom, okay? So let's talk about now cholesterol. And I do want to, who am I thanking? I'm thanking my super fans. All right, I'm thanking my super fans. So I do want to thank all of you. You're so supportive throughout the show, which is so amazing. And I love the fact that, everybody who tunes into the show, or you let your friends know, hey, hit that share button. It reminds me to say, hey, hit that share. Sam and Sana, thank you for following, and all my new followers that come in during the live shows. But please check out all my content. I have so much content on different subjects, right? Basically, you can go into the search term if you want to search something that maybe you're plagued by and you're dealing with your own health, or your daughter's health, or your friend's health, and you just put it in the search bar with my name, and on most platforms you will find a video. Now, if you don't find a video, please let us know, put it in the comments, and we will do our best to create more content around what you want to learn more about. And to continue this conversation now, and thank you to everybody who hit that follow button, and username 1 who followed. Thank you. It's great to have you all here. Hit that share button as well. Bring more friends into the conversation. But let's talk a little bit more about those causes of high cholesterol, which aren't, some of them, not so daunting, not always the worst thing. Okay, so and I will be coming back, I promise, to the beauty set, talking about what to do for those hollows under the eyes, okay? So here we go. Number 1, stress. Now we know that stress is going to offset our entire system. We know this. And one of these things that happens with cholesterol and stress is called pregnenolone steal. So if you've seen some of my other videos about pregnenolone steal, it's something that do we have the slide to explain it? I don't know if I can explain it here. We can come back to it. But that pregnenolone steal is something that is very common, and we can come back to it, and it's related to the leptin resistance as well. So that can be a cause for high cholesterol. So stress. So managing our stress is going to be important, right? As well as number 2, if we talked about it before, thyroid is under functioning, this can be a cause for that high cholesterol, okay? So that is another thing to be aware of, and very commonly, related to that leptin resistance as well. Okay, number 3, if you've lost a lot of weight, which of course is a good thing, your cholesterol can actually go up. And this is where, when we looked at that study with the elite athletes, endurance athletes that are, burning through their own body fat, maybe doing keto, or your, lower carbohydrate diet, you're taking in more of the healthy fats into your diet, your cholesterol could go up a bit. And that's not necessarily a bad thing, okay? So that's my whole point. Okay, we have the pregnenolone steal. So coming back to the stress really quickly, I just want to show you this really quickly if you've not seen this before. So cholesterol, we can see, is really important. It helps us to make our testosterone, our estrogen, and it is implicated in our thyroid hormones as well, regulating our blood pressure. But here you see cortisol, okay, stress. So with pregnenolone steal, what happens in times of stress and when you have leptin resistance is that pregnenolone is preferentially going to making more cortisol, which is that stress hormone. So if this is, on repeat heat, not necessarily a good thing, because now your downstream hormones over here, so your testosterone, estrogen, your progesterone even, can sort of suffer because we're making and we're dumping and making and dumping more cholesterol or cortisol all the time. So this is something that, yeah, this is definitely related back to leptin. So when your leptin signaling is off, you've got that leptin resistance and high leptin in the system, this is going to be happening, and this increases inflammation, also shuts down your thyroid even more, so that T4 to T3 conversion is going to be shut down even more so. So something to be aware of, okay, when we're talking about stress levels, of course, but that leptin resistance as well, and how this relates back to the low thyroid, especially if you're struggling to lose weight. This is all implicated here as well, okay? All right, let's continue with the keto diet as we talked about. So the keto diet can also, because of the higher fat intake, also raise your cholesterol levels. And number 5, caffeine. So this study, I want to show you really quickly, and not everybody is drinking 4 espressos a day, but in this study, it was a small study, they found that by ingesting 4 espressos a day, actually increased, and there was a positive correlation with higher cholesterol levels, and this was in young, healthy people. So something that they said, okay, considerable implications for public health and demands further scrutiny. I thought that was a little bit funny because, yeah, public health needs to know. I'm thinking of, you know, people in countries that drink more than 4 espressos a day, you know, comes to the Amalfi Coast comes to mind, and you're sitting and having your espressos by the seaside and just enjoying. Yeah. Are you going to be worried about your cholesterol? I don't think so. I don't think so. But I just wanted to share that information. Okay. Now I do want to share some tips for lowering cholesterol. So if you definitely know that you do have a cholesterol issue, there are natural ways to lower it. And I always get the question, well, what if I'm medicated? Well, ultimately, it's always your choice what you put in your body. You're working with your doctor. But a lot of people start to make those choices for themselves and start to look at things a little bit more naturally in terms of addressing cholesterol levels. And that's, you know, music to my ears. Being a naturopathic doctor, love to do things naturally without the negative side effects. And some of the things that I'm going to share are very easy to do. Like number 1 on my list, which is usually my number 1 tip for everything, is to get more natural sunlight exposure. And this is actually in the research. So they actually studied being in the sun versus vitamin D supplementation, and being in the sunlight actually helped cholesterol levels more so than supplementing with vitamin D. So increasing vitamin D naturally from natural sunlight exposure through sunlight exposure significantly reduced total cholesterol, LDL cholesterol, and the HDL concentrations. Okay, so that is very interesting. Natural sunlight exposure, and that means without sunscreen, without sunglasses, and not covering up your skin. So getting that natural sun light on as much of your skin as possible, okay? Really important. Now, number 2, of course, balanced diet. So having a healthy balanced diet, that goes without saying in terms of helping with cholesterol levels. And no, you do not have to abstain from having cholesterol foods like egg yolks and shrimp, and foods that contain cholesterol will not raise your cholesterol levels. Okay, that's a huge misconception. I could do a whole show just on that. So having a balanced diet, more seafood is actually good for cholesterol. Okay, number 3 on the list is to, of course, lower your stress. So whatever that means for you, lowering your stress response, doing deep breathing, meditation, going out into nature. I've done, you know, shows and talks about that and posts about doing just a 20-minute nature walk. That's what the research shows helps to significantly reduce your cortisol levels. So just go out and listen to the birds, listen to the stream, you know, if you can find a wooded area, the wind. These are all natural ways to lower that stress response, can help with cholesterol as well. Okay, number 4 is, of course, to fix your leptin resistance. Yes, you got to balance those hormones, fix that leptin signaling. If you don't know what that is, I've got a ton of content on it, so please check out all of my tips to fix your leptin resistance. And hey, make sure if you are following, okay, so I want you to hit that follow button, Laconic 2.0, and I see some Queen, I think, is here. Big Drew, thank you for the follows. Make sure you hit that subscribe button if you want more natural health information, news, research. That's what I'm all about. I'm Dr. Janine. Great to have you here today. If you're here for the first time, please hit that follow button. Make sure you are following me. You are subscribed so you always get my latest and best content. Okay, and we've got a bunch of new things on the horizon that we're working on. I'm super, super excited. My next book is coming out. I want you all to get the first dibs on all of my new releases, okay, and other fun stuff coming. Okay, so that leptin resistance, if you don't know what it is really quickly, it's all about your body signaling to get more food or not, and how much body fat your body has and all that, if the brain is actually reading those signals properly or not so much, okay? So fixing that leptin resistance is gonna help with the cholesterol. Number 5 on the list, limit your caffeine. That goes without saying. You may need to do that, okay? And number 6, doing that full body detox, really important to get those organs, especially the liver, better at dealing with and maybe not making too much cholesterol, because that is something that the liver can do when things are a little bit out of balance. The liver can do that, and that wouldn't be the healthiest situation. And of course, number 7, there are some herbal medicines that I love to help to balance cholesterol levels. One of them is FOT, another one is glucosterones. I also love plant sterols that work to help to block the actual absorption of some of those less favorable cholesterol particles like the LDL. Okay, does that make sense? All right, I hope you've got that. It is quiz time. Yes, it is. We are at quiz question number 2. I hope you were paying attention. Is everybody ready for this? So you're gonna have 30 seconds on the clock, and you're gonna be playing for the cholesterol formula from our great friends at Vitatree Whole Food Vitamins. Okay, this is what you're playing for. Is everybody ready? You got 30 seconds. Here we go. White spots on the nails can be a blank deficiency. You got 30 seconds to get your answers in now. Okay, you've got about 15 seconds left. And here we go. The countdown is here. 7, 6, 5, 4, 3, 2, 1. Everybody got your answers in. Oh, good job, everyone. This is very, very impressive. I am very, very proud of all of you. Good job. Yes, of course. Let's reveal the answer is a zinc deficiency if you get those little white spots on the nails. All right, so we do have our final quiz question coming up, so that will be coming up, so stay tuned for that. Let's talk a little bit about hollow eyes, and this is something that a lot of you were actually asking about, and some of the causes of having hollow eyes we will go through. So it could be clogged lymphatics. I'm going to show you the lymph chains in the body in just a second when we go over to the beauty set, and that is a #1 cause of, when you're seeing things change, and that's because, and especially if you're getting puffiness in areas of the face as well, that can be related to your lymphatics not draining properly. We're going to go through some techniques to help with that, okay? So that's coming up, and I'm going to show you those lymph chains. So that is something that can cause a hollowing of the eyes, as well as loss of collagen. So of course, as we age, our body's collagen is not where it once was, and this is another cause for that hollowing of the eyes. As well as we can see that vitamin C deficiency. So remember, vitamin C really does help with that proper scaffolding. So our collagen fibers and our elastin, they need to be nicely stacked from our procollagen. And vitamin C helps to maintain that structure as such. When we're lacking of vitamin C, that can also cause that hollowing of the eyes and that loss of that proper strength in the collagen, as well as a zinc deficiency. So if you're just tuning in, we talked a little bit about zinc deficiency a little bit earlier on, and I showed you the chart of all of the common signs and symptoms of a zinc deficiency, but that can be very much related to a hollowing of the eyes as well. And much like vitamin C, that zinc works with that proper scaffolding of your collagen, as well as, oh, was that it? Okay, that was it. Okay, so let's go to the tips now. How do we help with the hollow eyes? Okay, so really quickly, and I'm going to show you my guasha technique for hollow eyes. But #1, of course, this is probably a no-brainer. Take a good, high-quality collagen supplement. This is incredible. If you've never taken a collagen supplement, I'm just going to say from personal experience, I didn't think it could be as good as what it can be until I started taking it regularly. I take it Monday to Friday in my coffee, my 1 scoop, which is 10 grams of collagen every single day. And it's a hydrolyzed bovine collagen. It's unflavored. It's amazing. Love it, love it, love it. And it has done wonders for not only my hair, but my skin as well. Amazing, amazing. So it really is remarkable. So I highly recommend a good quality hydrolyzed bovine collagen supplement. Okay, a clean one, a clean one. Number 2, that red light. Yes, sunlight. So this goes against what you've heard to stay out of the sun, right? Because it's going to damage your skin. You're going to wrinkle. You're going to age so quickly. Well, it's not true, okay? So you have to get natural, healthy sunlight exposure, something that I've written a lot about in my next book. And this is really important because that red light, so the red light spectrum of the sun builds collagen. This is why the red lights and that red light therapy is so popular now, and it works because it's actually building collagen, so that can really help around the eye area. Of course, with red lights, you are closing your eyes. They do usually come with protective lenses, and it's recommended that you wear the protective lenses. However, I don't personally. I'm not saying that you don't wear them, but I don't wear them because I want the full benefit of the red light. Actually, with closed eyes, I always have my eyes closed, but I want the full benefit of the red light in my eyes. And I often, especially at, okay, so red light, when is the most red light? Let's do a little quiz question. Who knows when the red light is the strongest from the sun? Or the most effective, should I say? What have I said in my videos, okay? Does anybody know? Yes. Mark, sunlight is good, absolutely. Raina has it, of course. Sunrise and sunset are the best. Thank you so much, Raina, for filling us in. Raina's been following me since the beginning of time. So love when Raina is here on the lives. And yes, so sunrise and sunset, you're going to get a lot of benefit from the red light of the sun without the UV. So for people that are concerned and you think that the UV from the sun is very damaging to your skin, you don't have to worry about that when the day is starting and when of course, when the sun is setting. You get more of that red light benefit. Okay, number 3, of course, is whole food vitamin C. Really, really helpful for that scaffolding, remember? And not all vitamin C's are created equal. You know, I'm the vitamin queen. I talk a lot about vitamins and the wrong types to take. This is where a lot of people are getting it wrong. You're taking the wrong type of synthetic vitamin C, ascorbic acid. You don't want to do that. It's synthetically made, usually from genetically modified corn. You want to take a whole food source for your vitamin C, and I've got other videos on that, what to look for. Okay, hit that subscribe button if you want more information like what I'm sharing right now. Make sure you are subscribed, you are following. I'm so happy to have you all here today. I know there's so many new people here today, so it's great to have you all here. Thank you for tuning in. Okay, number 4, of course, is the zinc, but not any zinc. Zinc, for a lot of people, can cause a lot of stomach upset. It makes you feel sick to your stomach. That's usually a zinc chelate or a zinc gluconate. They can be really hard on your stomach, okay? So zinc bisglycinate is what you're looking for in a whole food complex because it's super gentle on the stomach. Zinc is interesting as well as a mineral because it needs a channel to get into the cell. It needs something called an ionophore. So for proper and rapid absorption, you're looking for a zinc that has an ionophore. My favorite happens to be a quercetin, opens up that channel so that the zinc can actually get into the cells, but great for your collagen, great for that hollowing of the eyes. Okay, and number 5, of course, is to do something actively on the skin, and the guasha and doing massage is fantastic. So let's go on over here really quickly for the hollow eyes. And I'm going to share my technique, which I love. And let me show you the lymphatics really quickly because this is important that we're aware of that lymphatic system, especially in the face. Now we have the whole body lymphatics, but in the face, do you notice here that underneath the eyes, this is a side profile, we do have lymphatics, and these are called the facial nodes. Now in front of the ear, and of course behind the eyes, we also have the other lymph nodes that are around the ear and behind the ear. Of course, whenever you've been sick, if you've had a sore throat, you probably felt these ones down in your neck and underneath this area as well, the big ones. And it's something that we definitely want to address, and we always want to move the lymphatics first. So any type of work that you're doing on your face, whether that's a guasha, you're doing facial exercises, face yoga, face massage, any type of work that you do on the face, I prefer that you always are moving that lymph first. So let's do this really quickly. Now you can choose to use a bit of oil, either a coconut oil. I love castor oil is my favorite type of oil to use, especially with the guasha because it stays forever. It doesn't soak in very quickly. It stays forever. You could guasha for like hours if you really wanted to by using the castor oil, okay? So all you're gonna do is put it, I'm not gonna do it myself right now, but put a little bit of oil on your fingers and on your cleanly washed face. I love to do these usually right before bed because then you have that relaxing effect just before bed. And then you're just gonna put your oil, your serum, whatever you like to use with your guasha or for your facial massage, all over your face, okay? Now, great thing to do is to open up the lymphatics. So we're gonna start above the clavicles, so your collarbones, and you just go gently with your fingers above and below your collarbones, back and forth, back and forth. Or you can even just do a little shake. I see some people online, they like to do a little shake. I prefer this sort of wisping motion like this above and below the collarbones, but you're gonna now be stimulating this supraclavicular nodes, okay? So above and below the collarbone. So you're gonna get that going. Then you're going to go down your neck, okay? Then you're going to go down, so I sometimes use my knuckles or you can use your guasha. You're going from the midline up to the ear, do a little shake like this, okay? Then you're going to repeat and then you're going to go down the back of your neck because you've got a lot of lymph behind the back of your neck. And then you can go up and back. So you can go up and back, up and back. So just creating some motion there. And then of course do it on the other side. So up to the ear, do a little shake like this, and then down the back, and then up the front and down the back. So like a little circle, up and back, okay? Basically, if you can't remember any of that, you're just gonna massage, massage. And I like to always go up towards the ears, do a little shimmy shake behind the ears. So remember, behind the ears, we've got those post-auricular nodes. You wanna definitely get those as well. Down the neck, remember everything's draining into the midsection. If we look at the lymphatics of the body, I think we have that chart. I wanna show that to you really quickly. The main channel is here, so in the mid of your body. So everything that you're draining from the head and neck has got to come down and drain in your midsection. So I actually do have a video. You can check it out. Just search it up. The 10 steps for lymphatic drainage. That's the full body lymphatic drainage, which is amazing. And people comment on my shoes in that video if you've seen it. So check it out. It's actually pretty cute. So that full body lymphatic drainage, amazing, amazing to get everything going. But if you're just doing head and neck for the purposes of your hollow eyes, you're doing what I just showed you. Okay? Now, with your guasha. Now, very gently. We know that, and depends what age you are, but you know that this is a very delicate skin underneath the eyes. And all you're gonna do is start at the midline. So I'm gonna do it with my mirror. Start at the midline, and you're going out towards, so where your tear duct is, and it feels nice and cool. So I know some of you like to put this in like a mini fridge and keep it nice and cool. So when you get going, or just in a cup of ice before you get going with your guasha, especially if you're starting your day with this is an amazing trick as well. So you're starting at the midline, so at your tear duct, and gently out towards the outer aspect of your eye. So just very gently like this. And it's just a gentle sweeping motion. Now, you can add to this. So I would do 5 to 10 on each side. You can add to this, you can actually go right around just above your, I hope you're doing this. So if you don't have your guasha right now, just do this with your fingers at home because it's good. Your brain will actually learn better by doing it when I'm demonstrating, okay? So you go out to the side and then up and around. Now the other thing you can do, especially if you are trying to open up your eyes, if you've got hooded eyes, is to actually get in with, and you've seen me do this before, with the point of your guasha, or you can do this with a spoon as well, even with your finger, is go into the tender parts, those tender bits that you've got, and if you hit a tender point, you're like, oh yeah, that hurts. It hurts so good. You're going to stay there for a few minutes just doing little mini circles to help to relieve that stagnant energy, that stagnant qi. And this is, based on traditional Chinese medicine. Wherever you've got stagnation and things are not, and that energy isn't flowing properly, and I can already feel like my eye is opening up and just feels so much brighter and lighter. And if the more that you do anything like this with the guasha and moving that stuck energy, that stuck qi, it is amazing. Okay, so and then you go into the other side from the midline out to the outside, Amazing, amazing. Repeat that, do that, and you will love it. For the hollowing of the eyes will help to just brighten and open up those eyes. And if you do have any kind of, stagnation and puffiness around the eyes, it will be alleviated. I guarantee it. You will absolutely love this. Just stick with it. You can't do it once, okay? Dr. Ranjit, you know what I'm talking about, right? Your patients probably have the same problem. You try it once, oh, doc, it didn't work. No, you've got to stick with it. Do this for every night for the next couple of weeks. You will start to see those changes. Really opens up and brightens those eyes, okay? So there you go. Please make sure that you are subscribed. Hit that follow button as well. Hey, share today's live as well. And it's so great to have so many of you here today. Stephanie, thank you for following. And is it Alyssa? Thank you, thank you, thank you. Great to have so many new people here today, which is amazing. Okay. Guess what time it is? We are quiz question number 3. So if you're just tuning in, we have different quiz questions throughout the show. You have the ability to win a prize. And this is what you're playing for. This week we are playing for Vitatree Nutritionals, our sponsor of the show, the cholesterol formula, okay? All natural vitamins, amazing, amazing. Is everybody ready for quiz question number 3? I hope you're paying attention, and even if you're just tuning in right now, no worries. Here we go with quiz question number 3. Just try your best. Name a cause of high cholesterol, something that we talked about today. I'm not going to accept the other answers that are out there if you were to Google it. Let's talk about the things that we talked about today's show, because a lot of them, I believe, are not so true. Okay, you've got 22 seconds left. Get your answers in. All right. Let's see. Okay, yes, a lot of people were paying attention. Hello in the Philippines. I missed your name, but thank you for tuning in today. 2 seconds left. Everybody got your answers in. All right. Okay. I hope everybody's subscribed. Thank you for sharing today's live as well. I see so many of you shared. Amazing, amazing. Okay, good. I see a lot of the answers that we talked about in the show. Good job. Let's reveal. I hope you got them in. Okay, I saw a lot of you said stress. Absolutely. Low thyroid. Yes, the leptin resistance. Did I see that? I'm not sure. Christine, thank you for sharing the live. I see that you're sharing like 10 times. Amazing. Good job, Christine. All right. Yay for Christine. Thank you for sharing. Low thyroid, excuse me, and leptin issues, as well as rapid weight loss. Yes, I am seeing that. Jeannie, you got that answer in. Yes. And music addict 14, losing a lot of weight can cause, yeah. So that's not necessarily a bad thing. That's what I was saying earlier, is that if your cholesterol is high, it's not always doom and gloom. It's not always a bad thing. If you've just, lost some weight, the keto diet as well, caffeine. I know a lot of you put the caffeine into and fatty foods is something that we talked about as well. Hopefully healthy fats. Patricia in Australia, nice to see you in Oz. Thank you for tuning in. Awesome to have you here. Amazing, amazing. And I see so many new names today, which is fantastic. I congratulate all of you for tuning in today and, participating in our quiz questions for learning more. So if you're just tuning in right now, we talked about vitamin do's and don'ts. Some of the best vitamins to be taking in the morning. If there's anything you do want to see, we have some more time that I can show you really quickly if you're just tuning in now. So best ones to take in the morning, best ones and my favorites to take closer to bedtime. We also talked about zinc deficiency, and of course we did the technique for hollow eyes. We talked about cholesterol, and we talked about breast implant illness as well. If there's any other slides that you'd like to see, please, yes, Vicious Trollop wants to see morning vitamins, please. Can we pull that up really quickly and show you that? That's such a funny handle name. Oh my goodness. I need a minute. Oh, that's good. That's good. Never ceases to amaze me, all the creativity that people have in their handle names, which is funny. Okay, so morning vitamins, magnesium. Yes, again, I know you've probably been told that magnesium, no, you take it at bedtime. No, you take it in the morning. Trust me on this one. Helps with your metabolism, helps with your cardiac function, proper regular beating of your heart, and it's so important. Helps to protect you against EMFs as well, which of course we have that exposure mostly during the day. Fish oil, your eye supplements, they work together. That's why I always take them together. The lutein and the zeaxanthin are best absorbed from your eye supplement when taken with healthy fats with those omega-3s from your fish oil. Vitamin D3, vitamin B12 are energy vitamins. They help with our energy throughout the day, so that's a great time to take those is in the morning. You don't want to take them too late. I also love CoQ CoQ10 in the morning because it helps with balancing blood pressure levels, but also helps as an antioxidant, helps with energy levels, helps mitochondrial function. So remember, mitochondria is the organelle that makes a lot of energy for you. So taking your CoQ10 in the morning is really one. It's really good. The night vitamins. Okay, let's go through the night vitamins really quickly. So K2, I prefer at nighttime with calcium. Remember, if you're taking calcium, and that's something we will talk about in a future show, is the right type of calcium to take. A lot of people are taking not the right type, in my opinion, of course, of calcium. So whole food calcium, your vitamin K2, those are taken together closer to bedtime. And this is going to help with sleep. Yes, it does. As much as you've been told that it's the magnesium that helps with the sleep, the calcium's even better, okay? So your magnesium in the morning, your calcium closer to bedtime with your K2. Your K2 ensures that your calcium goes into the right places, okay? And your sleep and relaxation herbal medicines, of course, you're going to take to relax your nervous system closer to bedtime if you're using it for sleep, of course, okay? The tips for cholesterol, yes, let's go through that list really quickly. And if you're just tuning in for the first time, remember we do this every Tuesday at 11 a.m. Eastern Standard Time. I'm Dr. Janine, your resident naturopathic doctor, and I'm not your doctor. I am your doctor. In a natural way, right? Sharing all natural information, which is fantastic. Balancing cholesterol, more sunlight exposure. That's what the research shows, getting more sunlight. And there's a few studies actually on that that's been proven in the research now that, yeah, the more natural sunlight you're getting, it actually lowers and drops your cholesterol levels in a healthy way. Balanced diet, of course, lowering your stress, fixing your leptin resistance, limit your caffeine, doing that full body detox, and cholesterol herbal medicines. Really, really important that those are available to be able to naturally lower cholesterol and of course, without the side effects of conventional things that people take for their cholesterol levels. Okay, so a question is coming up, the difference between vitamin D2 and D3, and I also saw some other comments coming in that you should never take calcium. It's dangerous, it deposits in the arteries. I will address both of those things tomorrow. So on Wednesdays, of course, is the live Q&A, so you have an opportunity to ask me all of your questions, and some of the comments that came up today, I will address those in tomorrow's Q&A. So it's hashtag Ask Dr. Janine, start using that hashtag, and it is Wednesdays at 1 p.m. So we will meet again tomorrow, 1 p.m., so different time, 1 p.m. Eastern Standard Time. Tomorrow, ask me your questions, and we do a little bit of a review of today's show. If there's something that you missed or you want me to definitely make that change. Oh, I just saw the doctor was saying something about how he prescribes the calcium later in the day. So isn't that interesting? Amazing, amazing. So I'm so glad to hear that. So yeah, so I will be answering and addressing your questions tomorrow. So please come on back tomorrow at 1 p.m. Eastern Standard Time, and I will be answering your questions. Well, thank you so much. And I know that there's more questions and comments coming in. I have my team behind the scenes. They will definitely be jotting down some of your comments and questions, but do come back tomorrow so I could answer a lot of them. If I wasn't able to show you out today, I do appreciate all of you. Thank you for tuning in today. I will see you tomorrow. And of course, tune in next week for the show on Tuesday again at 11 a.m. Eastern Standard Time. Every Tuesday, we do this again, the Dr. Janine Show. I'll see you then.